All right, so we're coming to the top of the hour and about ready to get started with our webinar today, noon on the East Coast. So I'm just excited to welcome everyone today to this webinar on the topic of from classroom to care and what can we do in the 2025 about educating nurses for the age of AI and virtual care. And we've got a really diverse panel that can talk about and is excited to talk about different aspects of it. And this came up thanks to Karen Henson at Avisher's symposium last fall. And towards the end of the symposium, she stood up and asked this question and said, "What are we doing about this?" And Cole, I know you were in the room there too, and everyone, it started a big hubbub. Yeah, yeah. And so we knew it was a topic of interest, and we've had great um, engagement on this webinar and a lot of registration. So we're very excited to get started. Um, so I'm going to start by introducing our panelists and then have them talk a little bit about why this matters to them from their perspective. Um, and so I'm very excited to introduce Dr. Karen Cox, who is the president of Chamberlain University, which is the largest nursing school in the United States. And she'll talk about how many she has enrolled right now, and it's overwhelming. And thank you. It's a big number, and thank you for helping us with the shortage. And she oversees the education of their future healthcare professionals there. And she has a career that spans decades in nursing leadership, including several positions of leadership at Children's Mercy Hospital, CNO, and then COO, and a magnet designation there, I noticed. And she's a big advocate for advancing healthcare education, fostering diversity, and preparing students to meet the evolving needs of patient care. So, Karen, can you just tell us a little bit about why this topic is important to you from where you sit?
Yes. Well, first of all, let me just go back and say a couple of words about my background.
Yeah.
I started as a licensed practical nurse. So I'm one of those individuals that started from the very beginning and really needed that path. And so um, to me, having those pathways in nursing is really important. And each degree I got the confidence to go to the next one. The majority of my career was, as you mentioned, in the hospital. And I thought that I would retire from the hospital, that somebody would roll me out in a wheelchair and with my boxes. But about 6 years ago, I came to Chamberlain as president. And the reason I came to Chamberlain was a couplefold. One is because it's the largest school in the country, both the largest school of nursing and the largest BSN program. We have the opportunity to do things at scale that no one else is really able to accomplish in the same period of time, and to be able to use my practice lens to support the work of specialty and practice ready and specialty focus. And so, but the other thing that made me really excited is that we have about 15,000 pre-licensure students at 23 campuses in 15 states. And 60% of those students are diverse. So again, if you have 400 students and you have 60% diversity, it's a different contribution. So we take that responsibility very seriously. And the reason that I'm so excited about this topic is I think nursing is at a real turning point, and we can go many different directions. But I think if we embrace AI, virtual nursing, and really think that through with all the people in the profession, not just leadership, I think we will see that transformation. And there's been kind of a fear about it, a fear that this means going away from ratios, which have somehow really
Mm.
become cemented. So that's really something very important to me, and it starts in education.
Absolutely. Thank you so much for taking the time to have this conversation with us today.
Mhm.
Dr. Cole Edmondson is a trailblazing nursing leader, and he now serves as a chief experience and clinical officer for Nurses on Boards Coalition. Is that right, Cole?
Chief
Is that
Executive
your title?
Officer.
What's that?
Chief Executive Officer.
That's what I thought. I'm sorry. My notes are wrong. Um, and your mission is to be the voice of nurses, to make sure the voice of nurses is heard in the boardroom and at decision-making tables nationwide. But your career has been very diverse, and you can also look at this from several angles. So tell us a little bit more about your background and how it's led you to where you are today and why you're interested in this topic.
Thanks, Lisbeth, and thank you to Avishur for hosting the webinar, and to my two amazing colleagues who are also a part of the Nurses on Boards Coalition as our founding strategic partners. So thank you, Chamberlain, and thank you, Community Health Systems. So I'm really thrilled to be here because, I have had the opportunity to work at the bedside, in the boardroom as a C-suite member, and now thinking about how can we actually start to think about the role of nurses in governance around AI and technology, as we think about the opportunity for nurses to serve. So the Nurses on Boards Coalition is really looking at that set of competencies to be able to understand how can we influence that? How can we be decision makers? And what are those competencies that you really need in this space as well? So having served as a chief nursing officer for 3 different facilities, having been able to actually serve as a chief clinical officer for AMN Healthcare for almost 5 years, I really appreciate what technology brings to the table. But like Karen said, I know oftentimes we are somewhat resistant to it, and we may be late adopters, and oftentimes in healthcare, it can sometimes add additional burden to the work of nursing and other healthcare professionals. I think this is really, as Karen mentioned, the inflection point for us. This is the time that we need to embrace technology. We need to embrace virtual care team members. We should be embracing robotics and care assistive robots. We should also be really thinking about how is AI supporting the nursing profession, not supplanting it, and how can it be supportive. As you mentioned, with Karen Henson, being there at the Avishore Symposium, when you asked that question, Karen, I was so happy because I kept thinking the first time that a nurse experiences either AI or virtual nursing should not be when they enter the practice setting. It should really be a part of the education and experiences of students. It just makes a whole lot of sense for us to think about where the care delivery models are going and how virtual nursing and AI become core components of that, and that we really prepare students well for being able to take full advantage of that and to utilize that as a third care team member, if you will. So thank you.
Ooh. So I'm going to put a pin in that because Karen Cox and I were just talking about that yesterday. The difference between learning about something and experiencing it. So we will definitely get back to that. I'm very excited to also introduce Karen Hansen, who is now serving as the Chief Nursing Officer and Vice President of Nursing Operations at Community Health Systems. And she also has a background in nursing leadership in individual hospitals as a CNO as well, and just kind of has that operations passion and skill set and background. And so, Karen, tell us a little bit more about your background and kind of what prompted that question at our symposium, and if there are any personal reasons why you're especially interested in this topic.
Well, thank you so much, Lisbeth and Avishur, and again to the colleagues here, Cole and Dr. Cox. So my pleasure to be on this panel. It's such an esteemed panel. And really, let me take you back to CHS at 68 hospitals in 15 states,
Mhm.
over 1,000 sites of care, and we are employing approximately 22,000 nurses right now. So of course we care, and we have to care about how technology, AI, virtual, is going to impact and continue to impact healthcare. But more importantly, what does that look like to the end user, to the bedside caregiver? And so we see them as a key stakeholder, and we all have to when we start to develop and look at AI in any of our spaces and virtual care in any of our spaces. If they're not at the table from the beginning, meaning truly our nurse leaders, not and our bedside caregivers, and even our nursing students, if they're not part of the team from the beginning stages of the design, we're setting ourselves up for failure. So let me just go to a couple of keywords that Karen and both Cole said. They used words fear and resistance. And I go back, and I'm sure all of you are going to be able to remember this on the panel, and many of our the people who have joined us. Do you remember when we went from paper charting to computerized documentation? And
I
I
do.
remember several of our nurses that were more of an aging population who opted to retire during that time period because of fear, because they had not had training to be able to document using keyboards and computers, and they saw it as what? They saw it as an added task. And so what we have to do is think of ways to um, transition our nursing students into our healthcare settings where we have virtual care models where it doesn't feel like an added task. And so again, thank you both for bringing up those words because it just kind of triggered that. I think technology overload also, Lisbeth. I have the personal piece to this is I have a daughter who just graduated nursing school, and the amount of technology that she was trying to learn to use, even in her PCT role while a nursing student and a nurse extern role, was so very challenging for someone who was coming into that environment maybe once or twice a month, trying to learn it, then going into clinicals, doing clinicals in different facilities and different organizations who did different technology. So it was just technology overload that I think we have to then also pause and think about how do we work with our academic partners to be able to prioritize and train and prepare those young nurses and those nursing students coming in. And when I say young, let me go back and say young in their career,
Yeah.
not young in age by any means. But how do we get our nurses to embrace that is by preparing them early. We will be talking a little bit later, I know, about some virtual nursing pilots that we're getting ready to embark on with Abashur, and very excited about that. And again, we talked about engagement at every stage and at every level. And so I do think that bringing in our nursing students a little bit earlier, enlisting and allowing them um, and creating an environment where they feel safe to share the challenges is going to be the most important thing to us. So that's really the passion for me was I think, as I'm listening and I was listening that day and as I continue to read a lot of papers and just listen to some great podcasts and conversations, I think we do have to find out quickly how do we get that new population of nurse coming into the field comfortable because they're really going to be the ones that are leading us forward into the future, and our nurses that are in the environment now may be less fearful when they see those younger nurses coming in who have embraced that technology. So that's really what led me here today, so thank you for having me.
Yes, thanks, Karen. And I couldn't agree more with what Cole said about this being an inflection point. And so, and personally, I had a mentor, Dr. Patricia Quigley, who told me that the nursing profession shapes you, and you have a duty to shape the profession. So beyond my day job, I pinch myself because my day job, I'm really focused on kind of transformation right now. Um, what can we take from what we learned, like Karen mentioned, about the implementation of the electronic health record, what went well, what didn't go well, to make sure that as we're at this point in history, we are leading on the nursing side. So one of the things that I do is I participate in professional organizations, and I was very excited to be asked by the Med-Surg Nurses Association of Medical Surgical Nurses to help them on their task force to design their professional certification for nurses called CAVRN, so Certified Acute Virtual RN. So that we designed the rubric and kind of the competencies and skills, and then they had very rigorous process for testing for that, and then that was launched in 2024, and there are over 100 nurses now already that have the CAVRN certification, including 4 at Abershire. So there's just many aspects of this, and before we kind of dig into our questions, and I want to get a little feel for the audience. So we're going to do a quick poll, 2 polls, and the first one is for you all to let us know what your current setting is. So I know that they're in health system, we'll say health system, hospital, you're out helping deliver care. Professional organization, I did see that we had some registrants from the Association of Perioperative Registered Nurses. So that's very interesting um, setting for nursing that also we don't want to forget. It's not just med-surg, and then academic, we had a few of those as well. So it looks like mostly on the health system side, but with some representation from the other settings as well. And then let's just do a quick poll on roles as well. I worked as a clinical nurse specialist, so I saw there were a few CNSs and educators, and some clinical nurses, and leaders and others. So that's a nice mix. I'm assuming you all are seeing the poll too, but it looks like a really kind of nice breakdown with a good amount of educators and clinical nurse specialists. So thank you all for joining us. I'm going to start with you, Karen Cox. I see 2 Karens. And just talk a little bit about Chamberlain University's approach. It's different than a traditional academic setting, and I feel like that allows you to be more nimble. Can you talk a little bit about your unique approach there?
Yes. So one of the things that I think is so different about Chamberlain, and you may wonder why I'm telling you this, but you'll see how it fits in. Most of higher education is about elitism. It's about who gets in. Everyone waits for the letter, who gets in. And our approach is we want to be known for who we let in and then who we can graduate and get through NCLEX. And so it gives us a whole different demographic of people that have different exposures in their lives about the healthcare system, but really about um, the social determinants of health. And so that's really important to us. And because we are a large program, we want to be known for also for being innovative. And so a couple of examples of that approach is we started something called Practice Ready Specialty Focused, and we're partnered with AORN as our first partner. And it's doing things like taking generalist nursing education, but layering on specialty in a way that helps them, one, either prepare and be ready for that, or 2, helps them know that sounded good, but not really. I don't really want to do that. And so innovation and looking at ways to embrace practice is just part of our DNA. What I would say about being able to talk about it theoretically and cover it in coursework is important as we do that and people get that understanding. But the real value is when they actually practice it. And remember, we're a practice profession, And so need help from clinical partners where there are opportunities to see virtual nursing to let them, even if it's not the same kind of experience, but just at least to see it, because there's nothing better than doing that. Um, and then I think uh, AI and really concentrating on how that can help impact practice in a way that we haven't been able to think about before. We're working with Dr. Amy MacArthur at Hippocratic AI, trying to develop education modules for nurses that think about it in many different ways. But I would say the most important thing for us is being able to educate nursing students who get to see this in practice and then are included in how it's developed,
Mm.
because that is really, I think, an important part of the governance.
Yeah, I loved your presentation at Magnet with, I think it was the CEO of Oxnard Health, in just talking about how you are helping them create their pipeline of diverse nurses. And so thank you for that work. I got like a little emotional when you were describing like the elitism versus the inclusion that you're focused on, and what a wonderful mission. So thank you for that. And did you get a chance I know you have a coursework on virtual nursing. Can you just talk about that a little bit?
A couple of things. We've worked collaboratively, jointly with Hippocratic AI and have developed those modules that can be shared with others. And then we developed a virtual nursing program with CE for large healthcare system, Trinity Health, a couple of years ago when they were really early on scaling virtual nursing. And so that was really exciting for us to be involved with them developing the curriculum. One thing I will say, and maybe we can talk about it in a little bit, but when you talk about virtual nursing, there's two different approaches to it, and they're very different, and they utilize nurses in two very different ways. And so being able to be part of that really helped educate us as a university on what some of those considerations are at the health system level.
Great. I think this will be a good transition over to Karen's perspective from the health system side. But before I do that, I'm sure people are going to be wondering, is that course available? Or is there anywhere people could go to find out more about that, Karen?
Yes. So we'll put something in for the attendees so they can go
Okay.
to those.
Yeah, because I've seen that course and it's fantastic. So okay, so Karen, can you talk about what are some of the challenges that you're seeing in new grads now versus a few years ago in your career in different settings?
Oh, yes, thanks. That's a great question. Um, when I think about 5 or 10 years ago as a healthcare industry, we had a before COVID. Let's just think about COVID, right?
Yeah,
The
yeah.
experience level of the nurse that we had in acute care settings, especially, was generational. And so I think some of the challenges that we're seeing from the acute care healthcare focus is the lack of experienced preceptors and mentors that are available in our systems. And so that again, when we talk about virtual in a few minutes, I think that that's a great opportunity for us. And one of the
Mhm.
things that led me to the original question, I think that um, we've transitioned to some virtual care and virtual trainings and AI. I think we still have opportunity in the acute care setting to make sure that that's the way the learner's prepared and it's going to thrive. Not all learners learn the same. We've learned that over the years with hands-on versus those who can do coursework and they're ready to go. One demonstration and they can perform the competency. But really, if I think about this question a little bit differently, we didn't have KPIs or key performance indicators and measures focused 10 years ago on on this specific area of challenges necessarily. We use the measure of turnover. And so I think that this is an area for us to transition into, again, moving forward with the future and making sure that what are we measuring and how are we gathering that information. We've got to bring some more analytics into this. And so what we've done here, and I think it's exciting news to share, is for the first time in CHS history, we've created a standardized nursing orientation that is based off of an evidence-based curriculum built by Dr. Leela Castile. She works here at the corporate office, but has also worked in some of our other academic locations throughout our country in nursing programs. She presented a body of work to our team, and let me just say, first, it was so funny. I enjoyed it. I picture this. She came in and she said, "This is what we have in current state," and it was a stack about 2 foot high of folders and papers. Right? That was. This is how we're training. This is what we're doing to prepare our new grads to come into the acute care setting, and we made a commitment that we needed to start looking at the individual learner before we put them into orientation. So we have built a digital platform. I say we, like she and her team built a digital platform and a new hire nurse, not just new grad, because let's pause for a minute. Remember, we have nurses who've never been in acute care that started their career in other areas that when they come into acute care, it's like being a new grad sometimes.
Hmm.
And so we have the ability now to do an assessment of those individuals, and we can tell by their assessment and their test taking where they fall in an orientation need. And so we've been, and some of that is coming in with some AI and some virtual pieces involved in it, but it gives us a really great foundational um, base to start with every individual and build an orientation program that's right for them. And so again, I think that it's exciting time. I think that while we have a lot going on in nursing, I think that the difference now is while we didn't measure before, we kind of knew mentally what we needed and where the barriers were, but now we're going to be able to digitally track and monitor and give purposeful reporting and make sure that progress evaluations provide real-time feedback to preceptors and to the orientees and to the leaders so we can keep our nurses on track. And then I think that that also leads to a body of work where we're really trying to focus again on looking at the past, looking at the future, where do we need to go? And that purposeful, those touch points are providing us with information, not just from the preceptor, but from the learner. But the preceptors, we quickly learned they needed additional training and
Hmm.
they needed more. So I think, and going back to the original question, Lisbeth, is we did not have the experience. We do not have the experience now that we need. So what are we doing real time and in the moment of preparing our preceptors, younger preceptors in their nursing careers for that role?
Yeah, Cole, what are you seeing as some, leadership best practices on transition to practice now in 2025? I think Karen outlined a really great one at CHS.
And thank you, Karen, for sharing that. I think it really is important for us to think about the preceptors, and then the transition to mentoring as a new grad nurse that, as you pointed out, is not necessarily young in age, but young in experience. And how do we support them? And really, how do we think about how those folks are going to be engaging with patients maybe differently than we originally engaged? I will tell you, in the early 90s, as a new nurse in the ICU in Oklahoma, and I shared this story with Lizbeth, is that after 6 months of experience, we actually had the opportunity to set the remote monitors for patients that were 200 miles away in rural Oklahoma in 1992, that we were actually monitoring EKG, heart rate, respiratory rate, and we were making phone calls when we saw something that was abnormal to
That's
support
virtual nursing.
nurses in that rural
Yeah.
setting. So not a new concept, but the technology is new. The opportunities are new. The ability to really actually kind of scale and scope it are differently. So what I'm seeing a lot is that, in these transition to practice programs, one of the things that has kind of emerged for me is the idea that the transition to practice doesn't begin at the end of your nursing program and after you pass NCLEX. It really begins when you step foot into nursing school, or maybe even earlier for other folks as well, as their CNAs or PCTs or in other parts of healthcare like phlebotomists. So the opportunity then to think about how do we actually redesign transition to practice so that the paradigm is not at the end but at the beginning, and thinking about the resources that that takes, from the academic programs, the educators in the facilities, the commitment of leadership to think differently about it, and then to resource it in a way that it's sustainable for new graduates to be able to actually stay in the profession longer. I know we oftentimes monitor kind of our first year turnover of new grads, but what about second year, third year, fifth year, 10th year, as we're thinking about that sustainability of our profession? So part of what I've always believed in is taking a look at your metrics, as Karen mentioned. What does that look like for either your internship or your residency model? And then how are you actually putting in maybe an accredited residency program that you can think about is going to be able to mark and measure the excellence of the program and the outcomes overall? So for me personally and professionally, transitioning as a new nurse through as a nursing assistant and then as an extern and then as an intern at an organization really gave me an incredible stability of practice and a professional identity in nursing, that was really set from the very beginning. So thinking about how we are all transitioning into practice, and most recently, one of the things I've heard and am still looking at a little bit more deeply is not even having practice ready graduates, but having residency ready graduates that are there. And it's kind of a subtle nuance, but then again, it's really not, right? It is about having them prepared for that next set of that residency model with their competencies so that, to your point, Karen, they can thrive and they can flourish, and then they can become our leaders in the future. So that's kind of what I'm seeing a lot in these programs now is accreditation, the ability to really mark and measure it, the new role of preceptors, and then a transition to a mentoring model, at a certain point in the residency program or their career.
I really liked what you said, Cole, that it doesn't, you know, start when you're done with nursing school. So, and Karen, I see you were nodding your head yes. So, because that kind of puts a little more onus on you. But how have you seen this shift forward more upstream in the last, I guess Karen Henson said it best, like pre-COVID, post-COVID kind of.
hmm Well, one of the things is trying to help, you know, once a new graduate gets to the practice setting, I know there are a lot of places that try to help them determine where they would best fit and what specialty. And in
Mm,
some ways, it's a little too late. So, what we're trying to do post COVID is ensure that students have an opportunity to experience another specialty in a deep way. So, and one of the things we're talking about is how do we incorporate into those specialty programs virtual nursing and more about AI. And one of the things that I learned myself is I theoretically understood what AI is, but in the last few weeks working with Hippocratic AI, I developed my own virtual agent, and uh, it was it was mind blowing. It was what this in it's the course of 10 minutes what I created in terms of data, and then an agent was developed. And I think the sooner nurses see what we're talking about and experience it, the better. At the minimum, they need to see it before you start saying we're going to replace certain activities with
yeah.
with AI. But you need to be able to show them just what I did,
Mm,
and so they understand the power of it, and it's not something that's thrust on them. So we're really trying to think through how we can set students up for the healthcare partners in a way that they're ready and they're open to it. I think the openness, when you go back to EHR conversion, I thought that was my first year as a CNO when we
Ooh,
converted from papers. I thought that was the end of my leadership career. How I did get through it, but I think part of it was we involved them a little too late in the process.
Yes.
It just because we didn't think they would want to be involved and it was just easier. So I think that's really important in education and practice is to get their feedback. And it's not saying we're not going to do it if you don't like it. We're saying we're going to do it, but we want you to understand it and see what your perspective is.
And I think this is kind of a call to action of those participating in this webinar. Most are working in the healthcare system settings or hospital settings, many CNSs and educators. So it's if you have a virtual care program, how can you help your nursing students experience it, not just learn about it, but see it, spend time with it while they're on their rotations. Karen, what are some of the things that you're doing at CHS to integrate virtual care training into your onboarding programs, and what are some of your plans coming up with virtual nursing and virtual care?
So currently, as you know, Elizabeth, we have virtual, we call them patient safety attendants. I know we refer to them as virtual sitters. So those virtual patient safety attendants really have, the program has been in place for several years, and we've learned a lot of lessons from that in-house and how to roll out a virtual nursing program and how not to. And so when we started talking about defining the role of the student nurse, um, of course, everything that we do strategically is going to be, again, structured learning and rotations. And so we're getting ready to start a pilot this year in one of our hospitals, as you're aware of, down in Alabama. So we've already started meeting as a committee and as a group. And we quickly understood that there's 3 academic partners there that we really need to pull into the fold quickly before we even start um, really further discussing the virtual nursing on one of our med-surg units. And why are we doing that is because, again, when I say structured learning and rotations, we can help provide some information and work collaboratively with the academic partners, because we'd like to see a virtual preceptorship model possibly where assigned student nurses, to work alongside of the virtual nurse in a real-time patient monitoring documentation type of situation. We've talked about, wouldn't it be nice to do a hybrid clinical rotations where we would combine some traditional bedside care with virtual nursing shifts to expose the student to both environments, seeing what that looks like on both sides. And then maybe apprenticeship pathways. So we have a program in place already in this facility where the students progressively take on more responsibility. Lots of healthcare systems have done this. We've heard of nurse externs, nurse interns. We have some apprenticeships. And so while they're employed and going to nursing school, we've talked about how could we go ahead again and pull them in under a virtual nursing supervision on some of their shifts, of course, not their nursing clinical rotations. But before we even can do that, we're like, we need to define that scope of the student involvement, right? I mean, there's a lot of work that has to go there, and what does that look like, and what does the students practice real-time documentation versus being coached by the preceptors versus clinical instructors versus virtual. So a lot of talk around defining the student involvement, the scope of involvement. And then, we want to also involve the faculty in our academic partnerships. So the faculty engagement is going to be so important to us. As we talked about before, we know there's certification programs for both the individuals who are working in the virtual space, but what would that look like even in our academia for some of our clinical instructors, that may be working in both or could possibly be a shared employed service between an academic partnership and ourselves, where we provide some of those virtual clinical instructors, which is a whole nother topic that I could talk on and on about. And then again, of course, looking at the technology and workflow integration, it's different. Just like Dr. Cox had mentioned, and I had mentioned earlier, when we did that shift and switch over from paper documentation into computerized, we were late to the game. And what we're doing now is we have a lot of people chasing the virtual nurse concept and wanting to create virtual care models. My fear is that if we don't pause for a second and start to backtrack a little bit, and how do we again make strategies for integrating the student nurses, we're going to make the same mistake again. And so we have to just take a quick pause and really think through that. And then what does all that collaboration really look like? We've got we see this as we have our corporate stakeholders who are going to be working alongside of us in our vendor relations with Avasure. The facility, of course, would have a steering committee, student nurse involvement, academic partnership involvement, measurements. What are we measuring? What does success look like? As we make this transition. And then what does the refinement phases look like and the involvement there? So that's really what we're looking at doing here with our first virtual nursing pilot at CHS, and we'll continue to be open to feedback and again, can't wait to hear what Cole and Dr. Cox continue to share here, because I think I'm learning so much just being on this call myself today and how to partner. So I'm looking forward to it.
Um, wow. We are going to kind of do a white paper based on this conversation. So I'm glad this is being recorded because that was a pretty rich answer. I wrote down a bunch of notes, but one thing that really I think is crucial is understanding how that virtual nurse can really expand the ability for senior nurses to be a mentor. And one of our hospital nursing directors told me this amazing story about a newer grad nurse that was going through like the shift from hell with like more patients than she usually took care of and very sick patients. And she was relying very heavily on the virtual nurse. And the virtual nurse was kind of keeping track of labs and deterioration, making phone calls to physicians. And that bedside nurse was I'm going to get a tissue because every time I talk about this, it makes me like a little emotional. The bedside nurse was like really relying heavily and calling the virtual nurse a lot with a lot of questions. And at the end of the shift, she's like, I have one more question. I almost hate to bother her, but she's like, I got to ask her this question. And she called and just said, am I doing a good job? My good nurse, and just to think that I'm just thinking, Karen, if your daughter is going into a highly specialized field, and if there was someone like that was that accessible to her that she could reach out, and so that kind of support and mentorship can be done virtually, and that's like I'm really excited to see. So okay, we're all nurses with big hearts, and that's like what I'm so excited about. But
But Elizabeth, if I could for just a
yeah,
moment,
go
because
ahead. Yeah.
that touched my heart too, and now I'm because I do think again, um, in the virtual space, the mentorship is the hardest part to measure. It
I
is the
do.
most needed.
Hmm.
And we have so many people. Again, I think every white paper everyone started with admissions and discharges. It seemed like the easiest things to track for virtual nursing. And I paused for a minute there and say, wait a minute, that's a lot of what we ask our student nurses when they're coming in clinical rotations. That's how they learn. And so we have to be careful again, not to take tasks that are going to take those important tasks that we're teaching our nursing students during clinical rotations and putting them on a virtual nurse, because are we robbing our nursing students of learning opportunities? So we have to think and think here. But so we're like, okay, we can do the easies, I say easies, but patient experience is an easy measure. Some of our quality safety measures, our emissions discharges are easy, which impacts GMLOS. But we are really wanting to focus heavily on how do we support the new nurse, because to your point just now, and I've heard my daughter say it multiple times, I don't know if I'm doing the right thing. I don't know if I'm doing a good job. I don't know, if I'm doing as good as the other, and I would have to try to steer that conversation in a different direction. So thank you for bringing that up, because I think that gets us back to the heart of the whole conversation, right?
Karen, Cole, oh, you want to jump in on that too? Yeah.
I'll share just a little bit. I love this conversation because I do think it is about supporting nurses who are ultimately supporting patients. And the way in which we can best do that is going to change and is changing through our preceptor models, through our mentorship models, through the use of technology and AI kind of being in the background there to be supportive of what we're doing and to be ethically driven, to be managed by a human, right? But to make those kind of recommendations that we saw early on when we first had the EHRs come out that were the medical early warning systems. I mean, when I think about the opportunity that that gave you to have insights into how your patients were doing when you were not eyes on, was really an opportunity to think about how you prioritize your work, your day, where you're going to be spending your time. If we think about documentation being one of the most probably burdensome things that nurses do, 50, 60% of their time, how can AI help relieve that burden? How can it help with the cognitive overload that people are feeling today? And then if we think that 100% of the work is going to be done by an in-person nurse today, I don't think that's possible because of just the supply challenge that we have, and even in the production model of new nurses, as well as even thinking about all of the different roles that they can have. So how do we actually think about part of this work being lifted and done by AI or robots, or technology of some sort that is going to make the practice environment safer for patients, safer for clinicians and nurses, and even I will go to this point and say more joyful around what we get to do every single day that brings us back to our core, as you've been talking about, in terms of why we exist, who we are, our clinical foundations, and knowing that we all do go different directions from that at times. But when we think about how we can make the biggest impact, I think these type of technologies give us expanded access to specialty knowledge. It expands access to care. It provides a safety net that is really important when we think about care being provided. And it supports new learners and also folks that are transitioning in practice or maybe transitioning in specialty as well. So I think of this as a huge safety net for nursing patients and our communities.
Karen?
One of the things that I mentioned earlier is that you really can look at how virtual nurses are deployed in different ways. There's a lot of different nuances, but one is where the nurse who's in charge of the patient care for that period of time is the nurse that's on the ground in physically present. The other way is to flip it and have the nurse who's virtual really be that person that's overseeing patient care. And that that approach begins to tell the story of what nurses do that's the most important. The tasks that a person on the ground has to do, those are critical. But the things that often get pushed aside because of staffing, because of how busy they are with that, are the things that are going to move our healthcare system forward. And that is focusing on the social determinants of health, spending time with the family, even though it's virtual. We've learned that we can do a lot virtually. Spending time with them, understanding their situation, and getting away from simply tasks to really trying to see this as a longer term relationship, and one that looks at how they live, how they how they can how they can take the advice given by health professionals and really employ it, and what is they need to do that. But again, those are the things that don't happen. The other thing is the virtual nurse can be the mentor, but mentoring in a different way. So either way works.
Yeah,
But one way really, I think, does begin to influence
transform.
and
Mhm.
say signal how important the work that you do in coordination and post discharge really is.
I
Elizabeth,
think
if I can add
another important.
one comment to
Oh, go
that, because
ahead,
Karen, I
Jack.
think you're exactly right. And as I think about the opportunities for virtual care, virtual nursing, is really following the patient across the care continuum
Mhm.
into the home. I mean, is there a reason why we have to have different care teams in different settings? But we probably need someone that is doing those care transitions, those connections, and understands the patient's journey through the entire system, even into the home as well, where a lot of care is being delivered and is going to be delivered as we have more and more opportunity to expand that. And a lot of that is thanks to technology. A lot of it is also the opportunities that we see, to your point, to improve outcomes overall, and to help, really, I think, create even more affordable healthcare in our nation as we think about where it's delivered, how it's delivered, who's delivering it, and how can this kind of be a democratizer in terms of
Mhm.
care outcomes to be able to create even more equity in care.
Oh, that's yeah. Let's change the world here, and that's what us nurses do. And I just one other cautionary thing that I think it's important to think about is when we use that term, kind of like, oh, virtual nursing and AI or technology will allow all nurses to work at top of license all the time. And I just think that can sound, I think, exhausting if it depends on what you mean by top of license. And I just heard a very good presenter, actually Brian Weinrich was the CNIO of Bon Secours, and he was talking about he started working in oncology, and a lot of the patients were women and had chemotherapy and had lost their hair and were on his unit for a long time. And his nurses often spent time doing manicures and painting the patient's nails. And during that time was when they had a very therapeutic connection and some very important conversations with their patients. And he kind of left us with that thought that painting your patient's nail might be top of license. Um, so I think top of license is important and nurses are holistic care, but let's remember that top of license might be something very, like Karen Henson said, hard to measure.
Yeah, and
Um,
I think
yeah,
you're
go ahead,
exactly
Karen.
right. And
Yeah,
language is sometimes the first thing to change. And I
yeah,
wish there was a way we could talk about all of this without two things, talking about ratios
mm,
as in general, and talking about top of license, because they already have such negative connotations, and we have people out there continuing to make it negative. And so, to your point, um, what brings joy to nurses is doing the work of connecting and real relationships and connections with patients and their families, whatever shape that takes. But I love the paint their nails example.
yeah. I can't take credit for it, but we only have 5 minutes left, and we had some great questions submitted already. So I'm gonna try to maybe cover one or two of them. And feel free, anybody who's listening, to put something in the chat. But Jacqueline Smith from Roslyn Community Hospital is the one that asked ahead of time about today versus 5 to 10 years ago. So thank you for that question, Jacqueline. And I think we covered that earlier. Two people, Stephanie Wank and Kristen Keeley, one's from Bronson Health and one's from Bay Health, were kind of talking about job descriptions and what are the experience and requirements of virtual nurses, I would put a little bit of a plug in for MSNCB Cavern certification in the rubric, and happy to share more information about that. But do any of you, Karen, especially have anything to share about kind of what are the experience and skills needed for a virtual nurse?
Well, I'll add to that. I hope Karen will add to this. The most important thing is somebody who is very patient and very holistic in their approach.
Mm-hmm.
Because if you're the virtual nurse and you're working with a nurse with less experience, which is usually how it's set up, you have to think differently. You're not going to be able to just walk in and say, I'll do it this way. This is how I do it. You just have to really have somebody that can step back and look at the bigger picture. But also, one of the things that um, is interesting is privacy and how they're able to ensure families patients and families feel privacy needs are met, because really you could go in and out pretty easily, and how you make decisions about how to do that, I think, is really important. Otherwise, there's going to be this feeling that people can't even talk in their room without somebody listening to them. So
Mm-hmm.
No, I think that first, let me just say that we are still working on our virtual nurse job description because we're waiting to see what areas we're going to focus on first. But to Karen Cox's point, um, I think that there's a couple of things. I think that we want someone who has empathy and has been and has experience. We are looking for someone with experience. We do feel like a virtual nurse has to have a couple of years of experience in the
Yeah.
field. If they do not have a virtual nursing certification, it's a preferred, but it doesn't mean that we won't help you get and obtain that virtual nursing certification. I think from a mentorship perspective, again, Elizabeth, you said something earlier when you were talking about um, how many times they were called upon by this one nurse. And so I think that a lot of the things that we're talking about are, again, those hard things to define, those more touchy feely aspects of the role that we're looking for. But we're looking for leaders as well. Someone who has that charge nurse ability and capability, because
Mm-hmm.
those individuals have to be able to help our young learners prioritize, because some of the areas that they struggle with the most when they come in is time management, the art of delegation. And it's funny because I think the virtual nurse is going to have to support by being delegated to, but also mentoring on how to delegate. And that I think is going to be there. I call it the art of delegation because I think that is going to be an art,
For sure.
right?
Well, we
And
are.
yeah, go ahead.
We are out of time, and I knew this was going to happen. But please come to our next webinar, which is about nursing influence in the boardroom. It will be with Sharon Pappas and Cole Edmondson and I. And if you're ever interested in maybe being on a board, or have that maybe in your kind of future career plans, this would be a great one to attend. And how do we encourage, more hospitals should all have a nurse on their board. So I'm really looking forward to Nurses at the Table, how to lead, govern, and influence healthcare. We touched on this a little bit. And before we even started the webinar, we were talking about nurses manifesting being leaders. Like both Karen Cox and Cole Edmondson had young nurses come up to them and said, I want your job. How do I get there? And I think both of them were success stories. And so let's encourage that in our new nurses. And so I'm really thank you all. This was a wonderful conversation as I knew it would be. And I hope you can all join us for the next one or one of these other events. So thank you all.
Thank you.